Hello, everyone. I am Dr. Lakshmi Pandey from the Department of Conservative Dentistry and Endodontics, SMBT IEDSR. It is in Nasik. Let's just start with the topic. The topic is direct filling goal. So, it is very important both as well as for undergraduate students and the students who are appearing for their NEET preparation. So, I'll start. The topic is divided into various parts. First, I'll be giving a brief introduction about what exactly is direct filling gold. The history, the few points in the history which is important for your MCQ purpose and which you can write for your answers, short notes or the long answers. The classifications, the characteristics of gold, factors influencing the selection of gold, uses of gold, forms of direct filling gold that is available. Indications of direct filling gold, contraindications, advantages and disadvantages, heat treatment, condensation, or compaction of gold, which is very important when it comes to the theory purpose, and biocompatibility of gold restorations. So let's just start with the first, the most important thing. Why do we call it as direct filling gold? See, the word direct itself means that it's a gold restorative material that is manufactured for compaction directly into the tooth prepared or the cavities. So what exactly does is you take the gold material in various forms and you directly condense in the tooth prepared or the cavity. First, the history. Giovanni or Arcolani made the earliest recording of its use. See, till 1700 or 1800, a lot of authors were there, which gold was published, or there were few authors or few scientists who used to use gold. But the maximum amount of gold use was after 1800. So, in which Chapin A. Marks stated it was not used until the year 1800. It is used of gold for the filling was common amongst dentists after 1800. Another most important thing which you have to remember for your MCQ purpose is in 1853, the sponge gold was introduced in the dentistry. Next, another thing is in 1871, what exactly happened was there was another form of gold that was named as corrugated gold was discovered. How it was discovered actually? What happened? There was a fire that happened in Chicago. So what happened? During that time, they used to keep gold in sheets. There was one carbon sheet was there was one gold, and then again one paper was there. During the fire, what happened? That entire paper or the gold melted or burnt in fire. After the fire, when they saw the gold, it has all the carbon incorporated into it, and that became the corrugated gold. Another most important year which you have to remember is 1920, in which a new type of gold was introduced, direct filling gold, that was new golden EZ gold. So let's go to the classification. The classification, according to the Skinner, which is important, it is divided into three categories: foils or electrolytic precipitate or powdered gold. It was further subdivided. Foils are further subdivided. Sheets, ropes, cylinders, laminated foils, or platinized. See, in further slides, I'll explain you exactly what is laminated foil or platinized foil. Another the subclassification of electrolytic precipitate is matte gold, matte foil, matte gold, and gold foil for the classification, and gold calcium alloy, in which a few percentage of calcium incorporation was there in gold. Another is powdered gold, encapsulated gold powder. Another classification, see, whenever you're writing any answer, you have to at least mention two types of classification given by the different author. See, another classification which I want to mention is given by the Mazuk. He divided the gold into two parts, that is a precipitated gold or a gold foil. The precipitated gold included the powdered gold or the matte type of gold, and the gold foil contained the plain gold foil, corrugated gold foil, platinum gold foil, or laminated gold foil. According to the Studevant classified into six types: gold foil, platinized gold foil, Crystalline gold form into three forms, that is matte gold that is wrapped in a foil, or matte gold that is alloyed with calcium. These are the further extra, which I think PPT will be available, so you people can read it later. Next comes the most important part is, see, whenever you read about any restorative material, the first thing which you have to know about is the characteristic. See, when you'll know the characteristic of the material, then only you can utilize for your benefit in the restoration. So the most important feature of gold is its nobility. So most noble material it is ductility and malleability. See, what do you mean by ductility is, when a material is ductile, it means it has a very excellent property of drawn into wires, or malleability is when the material has the ability to drawn into sheets. So how is it benefit or beneficial for your restoration is, when any material has a good property of malleability or is a malleable, it means it can be easily adapted to the cavity walls. So the adaptability increases when there is a good malleable property. It has a melting temperature. It can be another MCQ question. It is 1063 degrees Celsius, and boiling temperature is 2200 degrees Celsius. Another important MCQ question is, density of pure gold is 19 or 19.3 grams per centimeter cube. Next, it can be another neat MCQ, that is Brinell hardness number. It's 25. It has a very good tensile strength. It means it is capable of holding a weight of 7 tons per square inch according to IRIS. Another important feature or characteristic which you should know is, gold is dissolved by nitric or hydrochloric acid. It can dissolve by other chemicals such as potassium cyanide as well as bromine and chlorine. The bismuth or the mercury has effect on gold, or if you use 2.2% of lead in gold, it makes your gold very brittle. So next comes the factor influencing selection of gold. See, another point that is important is why you want to use gold as a restorative material. So these are the factors. First is physical condition of the patient, definitely. Mentality and willpower of the patient. See, what do you mean by mentality and willpower is, you earlier days the gold was very cheap, so it was very easily available, and it was supposed to be used in the cavity. Now, because of the price, high cost, the mentality and the willpower of the patient is very important. Next is age. Why this age criteria is important is, whenever you make a cavity for a gold restoration, the cavity are generally very deep. So, especially the patients, young patients, where the pulp horn are very high, you cannot use gold restorations. Strength of periodontal membrane and state of development of the root. It means if the tooth is periodontally compromised, the gold restoration is not indicated. Sensitivity of dentine, if too much sensitive, restoration is not indicated. Strength of cavity wall is very important. If it's not available, then the restoration is not indicated. Skill of the operator is also an important feature. Why? Because it's very technique sensitive. So whenever restorative material becomes technique sensitive, it becomes difficult for people who don't know how to use it to actually perform the entire step of restoration. Then aesthetic considerations or conditions. Yes, a person who are aesthetically very sound or wants very aware, such conditions or such patients, you cannot use gold restoration. Next comes uses of gold. It can be used in the different forms. Widely used as direct filling restoration. Alloy of gold are widely used in cast metal restorations. Stainless steel pins also used. Grossly destructed tooth also. We can use cast post can be used of gold restoration. Earlier, it was used as a gold restoration. Next, uh, another thing where you can use a gold restoration is, there are situations where you cannot use, you cannot, maintain isolation In such conditions, your gold restoration perform excellent. There are various forms of gold. As you can see in the picture, this is a foil form of gold. Here you can see you place a foil here, and then you can half, 1/4 or 1/8. This is how you fold the foils, or you cut the foils and you take the amount and you put it in the restoration or the cavity. It is available in books of sheets separated by pages of thin paper. The book contains 1/10 or 1/20 ounces of gold. Pellets of gold foils are generally rolled from 1/32 or 1/43, 1/64 or 1/128 sections cut from number 4 sheets of foil. The books of foil is marked and cut into squares or rectangle. Each pieces is placed on a clean fingertip and the corners are tucked in the center, and then it is lightly rolled in the pellet form. So what exactly happens is you get in a foil, in the sheet forms, and then you transform into various pellets or cylinders or whatever you want to use. Stored in gold foil box, which is divided into labeled sections of various size of pellets. Next is gold foil is supplied in the form of various type, plain gold foil or corrugated gold foil, platinized. See, the corrugated, which I explained you earlier, is it is manufactured by placing thin leaves of paper between two sheets of foil, which after which the container containing the paper leaves and gold foil is ignited. So you understood? The two sheets of paper are placed inside, and then the gold restoration, the gold sheets are ignited. Platinum gold is also, it is old type of gold foil produced in two ways, advantages or disadvantages. It has both advantages. The platinum gives you a good property, whereas it also, aberrate few properties of the gold restoration. Laminated gold foil, it is produced by combining 2 or 3 leaves of gold, each of different ingots, which have been cold worked in different directions. The laminates are now available as performed, but can be made in the offices by placing a number of sheets on top of each other and then cutting the laminates of desired sizes. Cylinders are also prepared from number 4 sheet foils. You roll it and then you cut according to how much modified or how much you need. Some people also use number 60 or number 90 gold foils. Next come extra applicable gold foil. It was produced to make gold more cohesive. This material is produced by wrapping a loosely formed regular gold rope and an extra sheet of gold foil. The rope is then used as it is or cut into pellets. It can be heated and condensed in the same manner as other golds, most commonly used in class 1 and class 5. Okay, next most important part of gold is you're knowing what is cohesive and non-cohesive gold. So, what do you mean by a cohesive or non-cohesive? Of First is free of surface contamination. So, what exactly happens is whenever this pure form of gold is available, there are a lot of gases that are available in the environment, that are present in the environment. So what exactly happens is this gold, the gold has the ability to absorb the gases or the contaminants that are present in air. So whenever they get contaminated, they became, see, the ability of two gold surface to cohere by welding at oral temperature is dependent on the atomically atomically clean surface. So whenever the surface is not clean or impurities are present on the surface, the adhesion of two gold particles becomes very difficult. So gold, like most metals, attract gases to its surface, and any absorbed gas film prevents the intimate atomic contact required for gold welding. So understood? So the ammonia treated foil is called as semi-cohesive foil. This is converted to cohesive by heat treatment. So what exactly it's explaining here is, whenever there are gases that are present on the surface of the gold or is impurities present, it becomes a non-cohesive form of gold. So what exactly is done in industries or the factories, just because there are some gases, they get incorporated very strongly. So what they do, they place ammonia. So ammonia, when it gets incorporated in the gold foil, the cohesiveness is very mild. So it's like during their transportation phase, they will place the ammonia, or they will make it impure. And when once you burn it or make it, heat treatment is done, it becomes cohesive. So the moment you heat the gold, the ammonia evaporates and you'll find the pure gold. So this is the system which they use for transferring gold from the factories to the offices, dental offices. Non-cohesive foils are those in which contaminants like sulfur, iron, or phosphorus are permanently deposited on the surface. I've already explained this. What are the type of cohesive gold foils? Soft type of cohesive foils or dead soft type of foils. Annealed before trimming and treated in ammonia fumes to reduce cohesion. Ammonia gas is driven off either by annealing in the flame of alcohol lamp or over an electric annealer to restore its entire cohesion. Dead soft type foil, not annealed, softer and much less cohesive than the soft type. It is softer and much less cohesive than the soft type, but may be reduced cohesive by carefully annealing. See, these are the types. You'll just remember the types only, that's fine. Extra or special soft, it has been deliberately alloyed with a trace of silver or binar its cohesiveness by careful annealing. Platinized soft gold foil alloyed with platinum, indicated on the incisal edge of the anterior teeth as a protection against abrasion in class 4 preparations. It is moderately cohesive when annealed, but its working qualities are little harsh. The commonest form of gold foil cohesive used is number 4, soft type gold foil. Next, you have to know about is electrolytic precipitate. Matte gold is precipitated through electrode deposition and it is accumulated in the form of strips or cones. These strips are cut by dentists into desired sizes. Matte gold is placed in a mold at room temperature to become compelled and is then sintered in an oven. In an oven. Sorry. The advantages, it is a sponge and adapts well to the cavity, and it is used for building up the internal bulk of the restoration. So I'll tell you exactly, or the end of the lecture, I'll explain you where exactly you use the foil, where exactly you use the matte gold, or the other forms of gold. Another is matte foil. It's sandwich of matte gold between sheet number 3 or 4 gold foil. Sandwich is sintered by heating below melting point of gold and cut into strips of different widths. Advantages, it is ease of placing gold in retention form and a reduction in placement time, especially in larger preparations. Disadvantage, greatly tendency for voids, which shows as spills on outer surface and restorations. So, what exactly I'll tell you in brief. See, your matte foil or your matte gold, the biggest disadvantage it has is it provides voids. So whenever you have a smoother finish you want, it's the foil forms which you use. Next is electroalloy. It is a combination of gold and calcium. Calcium content is 1%. It's an important MCQ question again. Advantages, product form provides stronger restoration. So the calcium that is present in this gives strength to the gold restoration. Disadvantage, inharmonious color. The color changes, high conductivity because of the calcium, and a difficulty of manipulation. Another form of gold that is available, which is a new form, is Top F gold. It is a new direct filling gold material available in market since 1989. Advantages, final restoration exhibits greater density than other form of granular gold. 50% increases in shear strength when compared to the gold foils. Another most important, which I told you, was EZ gold or powdered gold. It is a blend of atomized. It is a blend of both precipitated powder in a wax-like organic matrix. So what exactly it means is the powdered gold is mixed with the wax and is formed in ingots type or a cylinder forms. It is available in pellets of various sizes, which are enclosed in gold foil, wrapped and packaged for use. Prior to its condensation, the matrix is burned away, leaving only pure gold to be packed in cavity. So, as I already explained before, that the transportation of gold, pure gold form was very difficult. So, what idea they used was they used the powdered form of gold, they mixed with wax, and they formed into pellets. And the pellets were then, wrapped with this gold foils. So, what happened was when before using, you were supposed to heat those pellets. So, after heating, the wax was melted and the pure form of gold was available. Goldent is another form of gold. It is a combination of powdered gold and gold foil. The ratio is 95% powder, 5% foil. It is provided in cohesive form. Advantages was the envelope holds the powdered particles during condensation, making handling easier. Uses, it is used in many types of restoration. It can be purchased in assorted 1/10 ounces plates. Sorry. Indication of direct filling wood. I think I explained this. Here, let's just explain in brief. This golden is used in various form of restorations. Why? Because it has both the advantage of the matte type or the powder type as well as the foil. So it was giving the strength as well as giving the very good finish. Next comes the indication of direct filling wood. Most important, small incipient carious lesions, class 1, class 2, class 3, class 5, all the lesions, small lesions, maxillary mandibular, this direct filling gold is used. Especially erosion cases, it can be used, hypoplasia. Cases also it can be used, teeth with no enamel grazing or micro cracks. Atypical lesions, lesions with enamel margins can be located on sound tooth structure. Lesions in vital tooth also can be used. Other uses for restoring access, opening for endodontic therapy. Yes, post-endodontic restoration was also done earlier using gold restorations, but now it's not done because of the cost is very high. Faulty margin restorations can be readily accomplished with direct filling gold. Why? Because of the very good marginal adaptability first. Second, the high, not the necessary of the isolation or the uh, because when amalgam gets contaminated with saliva, the delayed expansion and all those problems are there. So in such cases, the gold is a good option. The contraindications, the handicapped elderly patients who cannot maintain their oral hygiene, the gold should not be indicated. Physiologically unsound patient, yes, the patient who cannot maintain their oral hygiene. Teeth with large pulp chamber, especially young patients, it's contraindicated. This is one of the Viva question as well, and also an MCQ question. Periodontally weakened tooth. If the survivability of the tooth is not there, it is not advisable to do a gold restoration. Large carious lesions, definitely gold is not in the option. Chalky or melted enamel could contraindicate the use of gold. Why? Because the strength is not available. So, present. If the strength is not present, if you use a restoration like gold, definitely it won't last long. Poor patient, the patient who cannot afford, or the high caries index, you cannot use gold restoration. You have to go for restoration like glass ionomer and hypoplastic areas. What are the advantages of direct filling gold? It's long lasting restoration, do not tarnish or corrode because it's noble metal. Insoluble, excellent property, has coefficient of thermal expansion almost close to the tooth. Atraumatic, no tooth discoloration. Direct gold adapts well to the cavity. I told you, malleable property. Ductility is there, ease to polish. Obviously, it gives a very shiner, smooth, very glossy appearance. High wear resistance, low tendency of molecular change because of the noble metal. Disadvantage, yes. Earlier, people used to consider it aesthetic. Now it comes as unesthetic. expensive, highly expensive, patient discomfort. Yes. When you do the compaction of the direct filling gold, there are some patients who feel discomfort. Limited to small cavities, large cavities you cannot use. Manipulation is difficult, even it's very technique sensitive. So it should be performed by the highly skilled dentist. And high condensation force may injure the tooth or the periodontal ligament. That's why if the PDL is sound, then only you're supposed to use it. Sorry. Heat treatment of gold. It is degassing or decontamination. Uh, Purpose of decontamination process. I'll explain for the slides. Wait. Yeah, this is better. I think nothing important is there in these two slides. See, what exactly is this heat treatment? It is also known as degassing. So there are three ways which you can make a gold pure form or cohesive form by doing this three heat treatment process. First is by an open alcohol frame or the piece method or desorption or flame desorption. So what happens? Most practical method of annealing. So as you can see in this picture here, this is a flame here. Can you see this part? This is gold. So what they used to do, they used to take the small pellets of gold or the small part of gold or the gold, the material, and they used to directly heat it under the flame. So when you heat whatever the gases, the material that was present on the surface used to evaporate, and the pure form of gold is available. So it is done simple alcohol flame. Acetone-free denatures alcohol must be used to avoid possible contamination from the source. The wick of the lamp should be pointed 1/4 long. If you take a more longer wick, there the contamination chances were increased. Gold is picked up with the point of the carrier brought to the hot cone of the flame. See, this is what I explained you earlier. You have to keep the gold till it is burnt, it's glowing red color. So when it's glowing red color, it means it has become pure. Another thing which you have to keep in mind is you have to see which part of the flame you are putting the gold. So there are various zones, right? So the highest energy is present in the reduction zone. That is which is the center part. First is oxidation, where you should not put there. The contamination chances increases, and you have to keep each piece for 2 to 5 seconds. For fibrous gold foil, this is uh, see, there are different types of gold are there. Gold foil is there, matte is there. So whenever you are using fibrous gold, you have to do instantly. Instantly means you have placed in the flame, you have directly placed in the cavity. Encapsulated powder gold has flammable indicators. Pellet is held in the flame until indicator burnt off and gold appears dull red. Alloyed filling gold or matte foil are held until the dull red appearance is observed. All the pieces must be cooled temporarily before carrying to the oral cavity. Pliers should not be used for pieces method since their mass results in uneven diagnosis. So what exactly it's saying that you should not use pliers, because even when you heat the plier, you're holding the material with the plier and you're going to heat it. So because of that, the pliers will also become red and you won't be able to, judge the color or the pure form of gold. Advantages: less wastage, ability to select gold of desired size and shape, elimination of chances of contamination of gold between annealing and use. It means you are heating here, cooling, and then putting, eating. So in between, different steps are not involved where chances of contamination is there. Another is amica over a flame, bulk annealing. Mica trays are used to hold the gold over the flame 5 minutes. Advantages: less time than piece method. Disadvantages: when you put in mica plate, the chances of sticking is there. Another, electric degassing or tray desorption, in which it is accomplished by a electric annealer. Electric heater controls the time and the temperature. The surface of heater is divided into small compartments. The estimated number of pellets of gold required for restoration is placed on the surface of the annealer at 650 degrees Fahrenheit. 5 minutes, and powder gold is kept for 15-20, whereas gold foil requires only 1 to 2 seconds. See, can you see here? This is electric degassing. Here you place the material, and then advantages is very convenient. You just have to place it. In flame method, you have to do it again and again. No need of assistant. Disadvantage, more wastage, danger of over annealing, sticking of pellets, air current affecting heat uniformity, and over-sintering. What is another is hazards of overheating, recrystallization and grain growth, incorporation of again impurities, adherence of whole mass of particles to each other instead of only surface items, complete melting of surface of the gold, making it completely non-cohesive, premature cohesion can happen. Underheating, incomplete removal of impurities, making material partially not leading to pitting and porosity, incomplete cohesion can occur. Now, the most important part of this lecture is compaction of gold. So, as you know, gold is a very technique sensitive. So, this compaction process makes it very technique sensitive. So, what do you mean by compaction of DFG? This condensation in a procedure used to condense and harden gold inside the cavity preparation. So, what is the objective? Gold is compacted by wedging the initial pieces between the dentinal tubules or the dentinal wall, sorry. Weld gold pieces together to ensure complete cohesiveness of their space lattice. Void should be avoided from critical area. The margins and the surface to prevent microlesion. See here, it is saying this bridging should not be there. Here, can you see here? Whenever you compact this type of bridging should not be there. This is how it should look. Strain hardening of the gold, adapt gold material to the cavity walls and floor, elastically deform the dentine of the gold and floor. So when we do condensation, we use hand instrument. Mallets are used, condenser and mallet. So the condensation energy produced by this method is not always sufficient. Initial increment of material within the cavity should be used using hand instrument. Next comes the automatic hand mallet, in which lodged, spring-loaded instruments that deliver desired force once the spiral spring is released. This was another form. Hand condensers. Here, can you see this is mallet, and these are the types of condensers that were used. Next, because of spring, also there were a lot of disadvantages. So the electronic condenser came. Max Shirley electromallet. Here it is. Accommodates various shapes of condenser points and has a mallet in the handle itself. Most efficient and controlling way. The vibrating condenser head can have intensity of amplitude from 12 to 15 pounds and frequency of 360 to 3600 cycles per minute. Another was this pneumatic type. You just have to know what exactly these types. It is given by Dr. George M. Hollenbach. This name is important. Pneumatic type, it works on the vibrating, vibration of principle, and air is carried through this rubber tubing. Can you see here? And then it is attached to the handpiece. Rheostat control the air pressure and adjust the frequency and amplitude of condensation strokes. Next comes your gold condensers. Yes. DFG condensers have faces that are serrated with pyramidal shape. It means this is the condenser type. So generally gold condensers have the serrations on the surface. Increases surface area of the condenser face, first thing, act as a serger, thus creating lateral forces which helps in filling the objection of condensation. Establish some triangular indentation in the condensed piece of gold so that the succeeding increment of gold may be interlocked and immobilized in these indentations. So this is different shapes of condensers that are used. Says Loma Linda instrument sets are there, Farrier are there. This is round condenser. Parallelogram, can you see here? Parallelogram condenser. Hatchet foot condenser. This is a very special type of condenser that is used mostly for a compaction of wood. See, the names are given based on the shapes, and primarily the function is the condensation. Next, most important part is the principle of condensation. Here, you should always start from the corner. Exert 15 pound per square inch of force on the condenser nib. Less force is needed for smaller condenser nibs than the larger ones. Force of condensation must be 45 degree to the cavity wall. Here, what is mentioned, that is very important. Force of condensation must be directly at 90 degree to the precisely condensed gold. So once you condense 45 degree, the next gold should always be 90 degree of the previous condensed gold. Stepping procedure, this is a very important short notes and also a Viva question. This is how you should do a stepping of gold. See, here you have placed one gold, the next gold, sorry, the next, the um, next part of condensation should include the half of the previous one. So can you see here? This is how it should be. Then the use of maximum thickness of pellets possible, provided that the condenser will not be no, will not penetrate it. The thinner like or cross section of each increment, the easier is the condensation. This will prevent crazing of erods. Okay, next important thing. What are the physical properties? I think in physical properties of dental material, it's already mentioned. I'll just briefly explain. Compressive, tensile, and shear stress. The compressive stress is quite high. The tensile strength is also good. The point which you should know is the failure usually occur in DFGs is from tensile stress because of the incomplete cohesion. So if you have not done the degassing properly, the chances of tensile failure is there. Another thing that you have to keep in mind when you're doing a gold restoration preparation, there are three things. That is, one is tie formation, next is banking of walls, and shoulder formation. Here, A, three-step build-up restoration. Next is paving of restoration, and C, surface burnishing, margination, burnishing again, contouring, and additional burnishing. See, burnishing plays a very important role when you're doing a gold restoration. So here, what do you mean by tie formation? I just explain you. Whenever you're doing a restoration, this is how your one layer here it is present in the floor and another on the axial wall. So whatever here you do, this makes the tie formation. So this involves connecting two opposing points angle, a starting point filled with gold with a transverse bar of gold. Here, can you see this is the tie formation? The foundation for any restoration in direct filling gold. Whenever you do a class 2 restoration, so this is exactly your axiopulpal line angle. Here you do. Resistance to displacement should be tested before proceeding to the next step. Next comes banking of wall. One side banking should be done. Next comes is shoulder formation. So if you don't follow that 45 degree and then the 90 degree of the previous condensation, this is what exactly happens. Can you see here? This shoulder formation occurs. This should not be there. To complete a build-up, it is necessary to connect two opposing walls with a direct gold material. These three steps should completely fill up the cavity preparation, but the build-up should continue until the preparation is overfilled. Can you see here? This part is looking underfilled. Paving of restoration. Every area of cave surface margin portion should be individually covered with excess cohesive gold foil. Foot condenser is useful in paving. Surface hardening of the restoration is instrument is moved all over the surface of the restoration in our direction to strain, harden the surface gold, and fulfill the rest of the objectives of condensation. Burnishing, done with proper instruments from gold to tooth surface, creates a solid glass sheet marginally, enhance surface hardening, adapt the material more to the margins, and eliminate surface and marginal voids. Margination, knives and files are used from gold surface to the tooth. Small increment should be removed at a time. Margination, removing whatever excess is there. Burnishing, that was pre-carve burnishing, that is post-carve burnishing, which is very important in gold restoration. This burnishing should be done at the marginal discrepancies. It again hardens the material. Strain hardening is done. Contouring, additional burnishing, finishing polishing, final burnishing. Next comes the biocompatibility of gold restoration. It is condensation energies, thermal energies, frictional heat, or galvanic currents. Whenever there's a gold restoration, amalgam restoration is present, it is liable for galvanic shock. Thermal energy, yes, when you do this annealing and you don't cool the restoration properly or the material properly, the chances of thermal energy harming your pulp is there. Condensation, yes, if you use a more amount of pressure on the mallet, condensation energy can damage your pulp. Width or effective depth of 3 to 3.5 millimeter of normal pulp will undergo a healthy reparative reaction. Less than 1 millimeter, there will be a destruction of pulp dentine or organ. Initial sign is cracking of pulp or axial wall. So the remaining dentine thickness concept. If it's less than 1 mm, destruction happens. 3 or more, no intermediary base is required. 2 mm, varnishes on the wall is required. 1 to 2, a calcium hydroxide or base is needed. Declining of gold restoration nowadays, yes, it is there. Patient factor, nobody's willing because of the aesthetic, money. Operator factors, yes, because it's very technique sensitive. The chances of you problems incorporating or failure increases. So more of the operators are not choosing for restoration. Patient factors, high cost, comfort, aesthetic, galvanic pain, allergies, one of the reasons. Material factors, economy, non-availability, yes. Conclusion. So I would like to conclude. So we'll just have a brief idea. You should know what is the classification, then you should know the characteristic, your advantages, disadvantages of gold. Then you should know the compaction technique of various hand millets or your pneumatic one, electric compaction technique. Then comes your tooth preparation, where you will know about the paving or the marginization or tie formation, banking or the shoulder formation. You should know a little about. And then your classification, each type of gold you should know. Their values are very important for your need purposes. And short notes mostly you'll get from the gold. No metal or the combination of metal serves dentistry so well in a wide range of application as does the gold and its several types. Without gold as a restorative material, the practice of dentistry would be a change significantly as no other material serve as its complete satisfactory substitute. So I would like to end my presentation. If anybody has any doubts, can mail me. My mail ID is drlakshmipande024@gmail.com. So I would like to end. Thank you so much.